Welcome to CFP Distilled. My name is Dr. Simon Moore.
And I'm Dr. Paul Dillon.
We are co-founders of the review course in family medicine. Every year we go coast to coast across Canada and help residents and practice-eligible candidates prepare for the CCFP exam.
You asked for it, podcast. That's what people have been saying over the past year, so we're doing it. We're switching from YouTube to superstar podcasters.
Exactly. So this is CFP Distilled. What do we do at CFP Distilled?
Every month we take the CFP Journal, distill it down to what you need to know when you're practicing clinical medicine and, most importantly, for the exam.
So let's dive right in and take a look. Let's start with July 2022 CFP Journal. What are the most clinically relevant articles that we need to know for the exam and for clinical practice?
So the first one is the self-BAT, and we're not talking about baseball here. It's the bleeding assessment tool.
All right, so step up to bat and let's take a look. The BAT and the case that they've got here is a 22-year-old person comes to your clinic and says, "Doctor, I filled out the self-BAT screening tool and it was positive. What do I do now?"
First thing you do is quickly turn on your podcast, Google, figure out what the self-BAT is. So it's a bleeding assessment tool, and there's two numbers you need to remember. It's greater than 4 for males and greater than 6 for females. So if people have that as their score, that's when you need to start thinking about investigations.
Exactly. So what kind of tests would you order? And that's a really important thing we need to know for the exam. That would make a great SAM question. What tests do you order for someone who needs to be screened for a bleeding disorder?
CBC, done.
Absolutely wrong. So I know in real life that's correct, but as you know, if you've been studying for the CCFP exam, CBC is not an acceptable answer. If you go to the reviewcourse.com/exam essentials, you'll find all the instructions that say what you can and can't answer on the exam. So what should we write instead on the exam?
We're gonna write hemoglobin. We're gonna write the specific indices that you're looking for. The article has a great PDF. It's a 2-pager that you can print out, great for reviewing, say the week before the exam.
There's a couple of other tests we're gonna order as well. Ferritin, activated partial thromboplastin time, and the prothrombin time.
What are some of the diseases we're thinking about? Von Willebrand's disease. Who can spell von Willebrand?
I think von Willebrand probably could spell it because it was
His
named
entire
after him.
family could.
Exactly.
But don't worry about spelling on the exam. If the examiner can tell what you're trying to spell, you're all good.
All right, and then management, it depends on the cause of the bleeding disorder, depends on the type of bleeding disorder. The infographics got it also, make sure you take a look at that. Let's move on to the next article, erythema multiforme in kids.
That is a great one and a complex one and a difficult one. The thing I always want people to remember at the CCFP hospital, right, when you're writing the exam, is you've got to keep a big, broad differential and make sure you rule out the deadly stuff. So any skin disease, you want to have a good, deep differential.
So again, could be a great SAM question. What are the differential diagnoses for someone with erythema multiforme? Think about the can't miss diagnoses, the fatal diagnoses. They've got 2, toxic epidermal necrolysis and Stevens-Johnson syndrome.
Yes, you want to remember those. Some of the clinical things that you want to look for is, are there pustules, are there blisters? And think about not only the skin, but systemically. How is the patient? Do they have a fever? Do they look sick?
Exactly. So if somebody's writing a question for the exam and they say, what causes erythema multiforme? What causes these target-like lesions that you see on the patients? Well, there's several things that you could be able to write down.
So you're going to start off with viral. HSV1 is the most common, could be HSV2. What is something that you don't want to miss, Simon? Maybe someone's been taking something from the shop.
Couple of other viruses, cytomegalovirus, Epstein-Barr virus, influenza virus, but no, I have no idea what your leading question is there. What kind of things do people take from the shop?
They go to the pharmacy, they had a bit of a sore throat, and they took some NSAIDs. So it's medication related. So could this be erythema multiforme that is caused by some sort of medication triggers? It could be NSAIDs, could be anti-epileptic medication. So really important to get a medication history from your patients and find out, is there anything over the counter that they started to take?
2 other important causes to know about: vulvovaginal candidiasis and mycoplasma pneumonia can also cause erythema multiforme. And you do want to take a look at the picture of the rash. So could they ask photograph questions on the exam, and how do we know that?
Sure, why not? Because when you do the practice exams online from the CFPC, you will see some images. So be prepared for images. I think, Simon, you're working on an amazing new derm resource for this.
Exactly. If you're part of our Facebook group, then you'll see the news when that comes out. All of these links that we're talking about, the practice exams, the old exams, what the exam software looks like, and also the Facebook group can all be found at thereviewcourse.com/exam essentials. Should we move on to the next article?
Sure. Let me take a sip of this water here.
Ooh.
You ever had podcasts for weight loss?
So relevant. So relevant.
Oh, that is delicious water. It's like clinical trial water.
Water for weight loss. Well, in one of these clinical trials, they actually provided water 2 to 3 liters a day to the participants to find out, does it help them lose weight?
Probably if you're carrying 2 to 3 liters of water around, that probably helps. I don't know if they control for that.
They did not control for that. There you go.
There
Poking holes in the CFP Journal.
Yeah.
That's what we do. So I guess the bottom line question is, does increasing water intake lead to weight loss?
So these studies don't hold water. So if you're the only interesting kind of piece for this to me was drinking, like preloading with water, which is interesting. So before you go sit down, have your big steak dinner, maybe you're doing keto, whatever, drinking 500 milliliters of water before you eat. So basically creating early satiety. Maybe that has an effect. Otherwise, not great evidence for it. That being said, your renal function is probably gonna be pretty good.
Not bad, yeah. So the bottom line for that, improves weight loss maybe by 1 to 2 kilos over 3 months if you give the folks 500 mils of water before a meal.
That's easy enough.
One last article, and this is an electronic article, so it is not in the print edition, but it definitely worth reviewing and definitely worth knowing. And this one's really vital for things that a lot of residents and practice eligible folks aren't quite as strong on. And we're talking geriatrics, care of the elderly. There's definitely a 1 in 5 topic on this. So what do we need to know from this article?
You've got to look for polypharmacy and then be able to take it that next step. So what can you cut down? What options can you give to your patients? So the first part of it, as I mentioned, is how do you decide? What sort of criteria could you use? If you were to create a question, Simon, what would you say?
Yeah, so there's explicit screening criteria. We all know about the Beers criteria. Interesting fact, Beers never became a geriatric because he died in his 50s.
Oh, did he choke on too many pills or something?
Probably not, because of the Beers criteria.
I wonder if all these people apply their rules to themselves. Who knows? The other thing you can use is stop start. So this is a little bit newer, something to look up in preparation for your exam. I think I would say pick one of the two, because essentially it's going to give you a framework, an idea about how to answer the question, how to look at that SAMP stem and break it down and say, these are the issues and these are the medications we could potentially stop for these patients.
There's another great tool they talk about called the Medication Appropriateness Index. Great mnemonic. And then finally, when we teach the Snowflake mnemonic at the review course, there's always a resource that you can use when you refer, especially when it comes to pharmaceutical overload, polypharmacy. Where could you refer this patient?
To the pharmacist, community pharmacist. It's often overlooked on the exam. When you think about who's a part of that clinical healthcare team, you can refer to a clinical or a community pharmacist to help that patient manage their medications. And don't forget something simple like combination therapy. If they're on 2 antihypertensive medications, put them together, give them 1 pill, easy mark.
So we've talked about the self-BAT bleeding assessment tool. We've talked about erythema multiforme, target lesion, and the differential diagnoses.
Water for weight loss and polypharmacy in the elderly. So 4 things, now you know them for the CCFP exam.